Hello, thank you for all of the support and for all of the views and everything again. So here we have another pathology which we have a lot to learn about for, and this is infective endocarditis. For this we have these bugs which are infecting a tree, so that's for infective endocarditis. Um, the large tree is to help you remember that there are vegetations present in the heart in this pathology. Um, and here the trees normally don't have arms, but this one has these prosthetic arms to help you remember that prosthetic heart valves make up some of the cases of infective endocarditis. Let's see. So let's go into the different organisms that cause this pathology. So we have through the oral tract, we have the tree telling all of these bogus riddles. So bogus goes with Streptococcus bovis, and riddles goes with viridans. Um, and then we also have here on the prosthetic limbs, or the outer skin of the tree, we see that we can have um, Staph aureus. So there is an aura above the face of this prosthetic limb. And also, since the tree has the skin layer, we're just going to say the prosthetic limb has skin. We're going to associate that with epidermitis. Um, then finally here we have one of these bugs is entering this tree and causing havoc. So we're going to say Enterococcus and the Hasek group cause more of the pathology. Um, and finally, the rest don't show an organism causing it. But apart from that, we do see that injection of IV drugs can be a causative agent for infective endocarditis. And the different things that you're going to see here in our acute and subacute forms are I drew a piece of bread for our fibrin. Here we have flames for inflammatory cells, and then tears for bacteria. And then here we have the sun coming out because it's morning, so you can remember that it is AM for morning, and that's your aortic and your mitral valves. So those are two common sites, unless you have this IV drug use where it's going directly into the tree. So remember, if there's IV drug use, that affects the tricuspid valve because it's going into the tree directly. And then we're going to look at the clinical signs here. The tree is sweating because it has a fever, and we have 4 different signs that we can see on a physical exam due to microemboli. And these are, as you can see, these fingers are giving a handshake to the tree, and this can cause a splinter to be given to the hand. So think of splinter hemorrhages with the nail beds here. And then the person who's trying to shake hands with the tree is named Jane, to help you remember that Jane offering the hand goes with Janeway lesions on the palms. And then here, the legs have all of these O's. That's to symbolize the osler nodes that can form on the feet. And then finally here we have a moth on top of one of the eyes of the tree. to help you remember that there can be Roth spots. And then here there is some sap flowing down um, through the middle of the tree. The sap symbolizes septic embolus. So that is that part. And I think that's it with this pathology. So good luck, and I'll see you next time.